Let's bring in NBC News medical contributor Dr. Natalie Azar. Dr. Azar, I want to start with this Delta variant. We keep hearing more contagious, more severe if you are unvaccinated and contract this variant. What do we know, though, about how effective current vaccines are against the Delta variant?
Well, good morning, Ellison. Well, the good news is that for the mRNA vaccines, and you're pretty well protected against the Delta variant. Now, this data is actually coming out of the UK, where they actually looked at how the Delta variant fared against the Pfizer-BioNTech vaccine, as well as the AstraZeneca vaccine. As you know, the AstraZeneca vaccine is not one that we have here in the US. And basically, after 2 doses of the Pfizer vaccine, your protection was at about 88%. So if we extrapolate to Moderna, which has the same, of course, technology with the mRNA, we can assume it's roughly the same. We don't, however, have that data with the J&J vaccine. But remember, in all likelihood, with all vaccinations, you are protected from severe disease. But we do have that, at least that granular data out of the UK right now, Ellison.
And there's a new AP poll that's showing a majority of Americans are returning to life before COVID, if you will. But what should we be doing to continue protecting ourselves from COVID-19 as more people are interacting daily? Are there still concerns, particularly in the medical community, that it might be too soon to be opening back up?
Well, yeah, I mean, I think you'll get a variety of opinions on that. You know, I think it is certainly safe to say that if you are fully vaccinated, you know, you can essentially go about life as you would have pre-pandemic. And remember, this also has to do with your own what we call risk tolerance. That means what are you willing to potentially risk based on your, you know, underlying medical problems, your household risks, that kind of thing. You know, we should spend some time talking about the fact that certain individuals who are immunocompromised may have not mounted as robust an immune response to vaccination. So in spite of the fact that they are fully vaccinated, they may not actually be as protected. If you're unvaccinated, this is a particularly perilous time, given the surgence, I should say, of the Delta variant. It's really increasing here in the U.S. at a clip, Ellison. And as you mentioned, it is likely more virulent and, as we know, much more contagious.
And Dr. Azar, you touched on the United Kingdom and studies there. There is a new UK study that deals specifically with the long-term effects that COVID-19 is having on patients. Take a listen to what former FDA Commissioner Dr. Scott Gottlieb had to say, and then I'll ask you a question on the back end.
About 300 people, a little over 300 people developed COVID. And when they compared those individuals who developed COVID against matched controls, people who were similar, who didn't develop COVID, they saw a pretty persistent decline in certain brain tissue matter. Certain areas of their brain showed a decline in actual tissue, a shrinkage of parts of their brain.
So what does this tell us, Dr. Azar, about how COVID impacts the body? Have we sort of reached a point where long-haul COVID can be looked at a little more closely than before?
Well, absolutely. And, you know, if you just look at the sheer numbers of people who've been infected with COVID-19 and the estimates of individuals who will have lingering symptoms after their initial infection, which, by the way, doesn't need to be severe. It could even be mild or asymptomatic infection. And you know, patients months later still having significant headaches and brain fog and exhaustion and fatigue. You know, it's incredibly important, not only the fact that many public health experts say that this will be the next public health emergency for the U.S. just in terms of dollars. But it's important not only to get insight into what's happening with COVID-19 and this post-viral syndrome, but all post-viral and post-infectious syndromes that have come before it, and specifically chronic fatigue syndrome. That community is certainly hoping that some scientific insight and potentially therapeutics will come out of this devastation. Ellison.
All right, Dr. Natalie Azar, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.